everyone, welcome to our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Obesity is one of the world's greatest health crises. Most of the world's population lives in countries where overweight and obesity is causing more deaths than being underweight. While many obese people live with disease such as diabetes because of their high BMI, not everyone realizes how much their long-term health is at risk. Obesity can significantly increase your risk of many diseases, and hormones are also linked with obesity. But unfortunately, because of the stigma attached to weight, many people don't think of obesity as the disease that requires treatment. Promoting a healthy lifestyle, not just weight loss, and having an open dialogue with healthcare providers can reduce the likelihood of developing obesity or obesity-related health conditions. And we have with us today eminent endocrinologists to give us advice on preventing and managing obesity. We're joined by Dr. Krishna Reddy Thaduri, consultant endocrinologist, KIMS Hospital, Kondapur, Hyderabad. Dr. S. Nasimuddin, a consultant endocrinologist, Aditya Hospital, Hyderabad. And Dr. S.L. Sagar Reddy, Assistant Professor in Videhi Institute of Medical Science and Research Center, Bengaluru. Thank you so much, doctors, for joining us today on the program. Dr. Thaduri, first question to you. If you could explain to our viewers, what is the role of hormones in our daily life, and how do hormones work?
Yeah, hi everyone. Good afternoon. Basically, hormones are chemicals that are secreted from the endocrine glands. So they will be secreted from one part of the body, and there will be action will be at the various parts of the body. So hormones controls the basic metabolism of the body, like carbohydrate metabolism, lipid metabolism, blood pressure, and reproductive function. So various functions are there for the hormones. So coming to the obesity and hormones, so various hormones like sleep hormones, thyroid hormone, cortisol hormone. So all these are interrelated to have produce more fat or more stress life lead to more obesity. So all this, if any disturbances, these hormones can cause high overweight and obesity. So there's the importance of hormones.
All right, Dr. Nasimuddin, now obesity is a chronic medical disease whereby the body carries too much body fat. Is obesity a hormonal disorder?
Good afternoon all. Obesity essentially occurs when there is a loss of balance between a higher energy intake and lower energy expenditure. It can happen either due to a genetic cause, behavioral reasons, use of certain medicines, or as well as many hormonal disorders can cause obesity. Hypothyroidism is one common hormonal condition that can cause weight gain. It causes weight gain due to decrease in the basal metabolic rate. Excess steroids in the body, also known as Cushing syndrome, can cause weight gain. This Cushing syndrome can happen either due to a tumor in the body or due to excessive use of steroid medicines. Deficiency of growth hormone, which is a hormone produced by the pituitary gland, as well as deficiency of testosterone in males, can lead to excess fat deposition in the abdominal region that can cause central obesity. One hormone which has been found to have significant role in obesity is the leptin hormone, which is produced by the fat cells. It acts at the level of brain to reduce a person's appetite. What happens is that in some patients, this leptin may not be able to act properly. That is, they will have a leptin resistance, or in some patients, they may not be able to produce this leptin adequately. Both of this condition may lead to obesity. Also, resistance to insulin hormone, which we all know leads to development of type 2 diabetes, has also been linked to metabolic syndrome and obesity.
Right. Dr. Reddy, now being overweight and obesity are two different conditions. If you could tell us, what is the difference between these two conditions?
So, good afternoon, everyone. So, to compare weight among individuals, we calculate something called BMI or body mass index. Now, overweight and obesity come under the spectrum of high BMI conditions. Now, overweight for Indian cutoff is more than 22.9 kg per meter square, whereas obesity is more than 30. Whereas if you see the Caucasian cutoff, they're slightly higher, that is 25 and 30 for obesity. Now, this is because we Indian are being considered as lean, obese individuals, and we have a higher visceral fat compared to the Caucasian counterpart of same weight. So, coming to the consequences of overweight and obesity, both have increased risk of diabetes mellitus, myocardial infarction, heart failure, sudden cardiac arrest, or polycystic ovaries, or even cancers like endometrial cancer, colonic cancer, prostate cancer. Now, overweight has a twofold increase for these conditions, whereas obesity has up to tenfold increase for these conditions. Yes.
Right. Dr. Thaduri, do obesity and diabetes go hand in hand, and how are obesity and diabetes related?
Yeah, so definitely any type 2 diabetes, the initial stage is overweight and obesity. So if you see the statistics wise, in the India, the obesity and prevalence is almost ranging between 12 to 30%. Anywhere, almost one third of the patients are obese. And type 2 diabetes, if you look at the figures, almost on an average, 10% of the Indian population has type 2 diabetes. So the diabetes starting stage is the insulin resistance, followed by the decreased insulin secretion capacity in the body. So to have an insulin resistant any patient, the major things are physical inactivity and malnutrition, like consumption of the excessive carbohydrates and cholesterol. So this will lead to the excessive fat accumulation, especially visceral fat accumulation in the body. So this will, as a starting step to the type 2 diabetes, they gradually progress to the to have a dysglycemias. So the prevalence of both these conditions are increasing in trend. Even in the rural populations of India is also having excessive overweight and obesity. This could be related to the lifestyle changes, and access to the processed food has been increased, and the lifestyle, the working lifestyle of the population is also been becoming sedentary. So all this will leading to the current epidemic of diabesity. So we call diabetes plus obesity as diabesity. So before COVID-19, so this is the major epidemic is going on across the globe. So this is a major challenge now. So after COVID-19, to tackle the obesity as well as increased risk of type 2 diabetes.
All right, Dr. Naseemuddin, various prescription treatments for obesity are available, especially on the internet. Do these medications really work for weight loss, and is it safe to take these medications?
Yes, there have been numerous medication used for treatment of obesity. Older medicines were usually acting at the level of the brain to reduce a person's appetite. These drugs were found to be effective, but they had few side effects like increased heart rate, palpitations, and other. Availability is also an issue in the current scenario. Lipase inhibitors is one group of medicine which is currently widely available and quite safe. When taken in oral form, it basically reduces the fat absorption by the gut. If the patient has not decreased his fat consumption after taking the medicine, it can cause minor abdominal discomfort. However, it is not very serious. It can also cause deficiency of fat-soluble vitamins. Hence, a multivitamin tablet is usually prescribed along with using lipase inhibitors. Currently, the most widely used medicine for obesity comes in the form of subcutaneous injections, which can be taken either once daily or once weekly. Results have been quite encouraging with it. Now, even though these are quite safe, in some patients, it can lead to gastrointestinal side effects. If the obese patient is also diabetic, then certain anti-diabetic medications are preferred, like metformin and SGLT2 inhibitors, that will also promote the weight loss. However, it is very important to note that whether the patient is going to take medicine or not, lifestyle changes should always be incorporated.
All right. And Dr. Reddy, talking about weight loss diet plans are an important part of obesity treatment. But what is the best diet program to lose weight, and does a diet program really work?
Yes. So various commercial diet plans are available for weight reduction, like a low carbohydrate diet where we restrict the carbohydrate intake, like Atkins diet or South Beach diet or zone diet. And there is a low fat diet where we reduce the fat intake. There is a high protein diet where we increase the protein content in the food. Mediterranean diet where we encourage the patients to take more of proteins, vegetables and fruits, and reduce their red meat. Keto diet of late has been very much pronounced, where there is extreme restriction of calories and increase in protein and fat content. Now, all these diet plans have their own pros and cons. And on average, all of them produce around 3 to 5% of weight loss. And this weight loss also depends upon patients' biological and psychological factors. Now, what I advise for my patients is a low carbohydrate, low glycemic index diet, where they have to be mindful of what they are eating. The proportions of carbohydrate and fat has to be kept for minimum, and increase the protein and fiber content. And of course, to maintain daily physical activity. So that works fine.
All right. Dr. Thaduri, bariatric surgery is one of the most effective treatments causing weight loss and reducing complications from obesity. Who is the right candidate, however, for a bariatric surgery?
Yeah, so in India also bariatric surgery is gaining its popularity. For losing weight, we have several options like lifestyle changes, adding dietary plans and exercise, and some of the medications that will work for the obesity. But several of the patients, especially if the BMI is high, so it's very difficult for them to get back to their normal weight. So for example, if the patient is having a BMI of more than 32, Asian cutoffs are more than 35 in Western populations. So these are the patients, especially if they have a comorbidities, as I already discussed, like there's a obstructive sleep apneas and type 2 diabetes, hypertension, dyslipidemias, and fatty liver and osteoarthritis. So all these conditions, any comorbidities arising from these obesity related complications. So these are the ideal candidates to go for the bariatric surgery. Because anytime the patient is started on lifestyles and they're able to achieve a weight loss of around less than or equal to 5% of weight loss, still after some time the body try to bring the weight to back to their normals. So if especially if the higher BMIs, this is a major risk. So the failure of lifestyle is very common. So that's why these are the patients they can undergo, especially if the BMI of more than 32 with any comorbidities, or BMI of more than 35 without any comorbidities also. These are the ideal candidates. And there should not be any contraindication to the bariatric surgery like GI disturbances or any GI related previous surgeries and other cardiovascular morbidity, high morbidity, higher risk for the development of complications during the surgery. So these are the candidates should not go for the bariatric surgery. Otherwise, especially high BMI candidates and with the comorbid conditions associated with the obesity. So these are the patients should undergo bariatric surgery. There's a high likelihood of type 2 diabetic remission and hypertension remission when they undergo bariatric surgery, and quite a good amount of weight loss, almost more than or equal to 10% of the weight loss can be achieved with these surgeries.
All right. With that, we'll slip into a short break and return with more questions for the doctor. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about obesity and hormones. Dr. Naseemuddin, some people say after weight loss surgery, if you don't take care of the diet, you'll gain weight again. Is this correct?
Yes, weight regain is not uncommon in patients after bariatric surgery. Usually after bariatric surgery, there is loss of around 65% of the excess body weight that the patient was carrying initially. These best results are seen mostly around after 2 years after surgery. But what happens in the next 5 to 10 years is that many patients starts to regain a significant portion of their lost weight. This mainly happens because of lack of control over eating habits and lack of exercise. The type of surgery may also determine whether weight regain may happen or not, or some surgeries which are minor surgery like restrictive surgery like gastric banding, weight regain is more commonly seen. It is very important to prevent this weight gain because it will definitely affect the quality of life and lead to reappearance or worsening of the weight related illnesses like hypertension, diabetes, and obstructive sleep apnea. Best way to prevent this is to have regular consultations as advised so that the food record and body weight chart will be maintained. Patients should also comply with the recommended diet plans, should also continue with regular physical activity, which should be at least of 150 minutes per week. This patient group needs continuous motivation. It's very crucial for them, and hence behavioral therapy may also be sought in some cases.
Now, Dr. Reddy, does weight loss surgery, since we're talking about weight loss surgery, does it increase the risk of alcohol abuse, and what are the do's and don'ts of bariatric surgery?
So the Western data does shows that there is some risk of alcohol abuse disorder following bariatric surgery, especially these malabsorptive surgeries. But various reasons have been proposed, like the alcohol is absorbed faster following surgery, or there are changes in the hormones which act at the brain reward centers. And these people may have alcohol abuse disorder prior to the surgery, which may just be carried over later. Or and there is increased risk of depression following surgery. So various mechanisms have been proposed, but extrapolating this data to our Indian scenario has to be taken with a pinch of salt. As far as do's and don'ts following bariatric surgery, yes, I advise all to have a regular checkup with blood test, especially in first year following surgery. And patients have to maintain a balanced diet with adequate vitamins and mineral supplements. They have to maintain their daily physical activity. And yeah, they have to be watchful for the symptoms of complications. And of course, they have to maintain cessation from alcohol and smoking.
Right. Dr. Thaduri, are weight loss surgery and liposuction the same thing? If not, if you could explain, what is different?
Yeah, it's an important question. Many people think that liposuction will lead to weight loss, similar fat loss, and bariatric surgery also will lead to the weight loss. But the both are different, and especially if you are looking at the long-term outcomes in terms of cardiovascular morbidity and type 2 diabetic remission, this liposuction is generally better avoided. Liposuction generally does with injecting with microneedles normal saline into the adipose tissue, especially over the abdominal area, so that they will aspirate that subcutaneous fat. So with this procedure, they can remove almost up to 30% of the subcutaneous fat over the abdomen. So as a cosmetic purposes, this will give the immediate results, and the patient may look better in terms of cosmetic purposes. But if you look at the other metabolic parameters and cardiovascular inflammatory markers wise, there is not much improvement in insulin sensitivity. So the type 2 diabetic remission is also not that good, as well as the obesity related cardiovascular inflammatory markers are still elevated after the liposuction surgery. So this could be because of mainly we are removing the subcutaneous fat, but not the visceral fat compartment is still there. So there is a still active fat is going on, active inflammation is going on. That's why the insulin sensitivity markers as well as the cardiac inflammatory markers are still high. Whereas coming to the bariatric surgery, so it will give the overall the food intake of the patient will be less. So it is like a cardiac calorie restriction. So over a long term, that overall body fat, visceral fat as well as the subcutaneous fat will be reduced through bariatric surgeries. So here over the period of 2 years, where the good weight loss benefits can be observed, like remission of the type 2 diabetes, remission of hypertension, reduction in the inflammatory markers in the body, which are directly proportionate to the future cardiovascular diseases. As well as studies also proven that with the bariatric surgery, the insulin sensitivity will be improved. So this is the ideal for the persons with obesity with having a comorbidities like type 2 diabetes and other cardiovascular risk factors. So both are different. So as an endocrinologist, we generally advise a bariatric surgery over liposuction.
All right. Dr. Nasimuddin, is it better to completely avoid saturated fats from our diet, or do we necessarily need some of them?
Saturated fats are mainly found in animal-based foods like meat, poultry, eggs, full-fat dairy products, and in tropical oils like coconut oil and palm oil. This saturated fats tends to increase the LDL cholesterol and apolipoprotein B, which both are bad cholesterol which in our body. This may lead to clogging of arteries and increases the risk of future heart diseases and stroke. So many bodies, including the American Heart Association, has recommended to consume saturated fat only to about 5 to 7% of the total calorie intake. Research have also shown that replacing this saturated fat with unsaturated fats, especially PUFA or polyunsaturated fats, has a positive impact on health as well as overall cardiac risk factors. These unsaturated fats are mainly found in foods such as walnuts, seeds, plant oils, and in fish. But recently, there have been concerns raised that a diet which will be totally devoid of saturated fats will also have low HDL cholesterol, which is the good cholesterol. So it will reduce the protective effect of HDL on the heart. Also, one must take into factor of the food matrix and dietary patterns. Like for example, yogurt will not only contain some saturated fat, but it will also contain good fatty acids, proteins, potassium, number of essential nutrients like calcium, phosphorus. So there is no point in completely avoiding yogurt. It may not be a good option. Hence, it is better advisable to target on reducing saturated fats to about 5 to 7% of total calorie intake rather than trying to completely avoid it.
All right. And Dr. Reddy, finally, is obesity genetic or is it something that is psychological?
So, more than 400 genes have been identified for the cause of obesity, but still it contributes to less than 5% of general obesity risk. So, patients with genetic mutation usually present with early onset and morbid obesity. So these patients actually, genetic analysis in these patients definitely benefit as there is a definitive management for these patients. And rest 95% is because of psychological factors and poor lifestyle, that is imbalance between calorie intake and utilization, poor physical activity, maybe because of their medical conditions or even medicines, and stress. So these patients do require dietary modification, have to increase their daily physical activity, and few selected patients, as we have already discussed, require medical management, and definitely bariatric surgery will help in these patients.
All right. Thank you so much, doctors, for joining us on the program and, really creating awareness around this issue. Thank you all for watching at home. Time for us to slip into a short break. More news updates on the other side. Stay with us.